We want to turn to New York State's medical marijuana program, which was signed into law almost 8 years ago. But this week, major changes. For the first time, doctors can now prescribe medical marijuana for any condition that they think it will help, not just a pre-approved list from the state. This comes as New York's Office of Cannabis Management, which is part of recreational legalization, takes over the medical program from the state health department. Joining us live is Maria Caserta. She is with Dent Neurologic Institute in Amherst. She helps market the medical marijuana program there. Maria, great to see you. Thanks for coming on.
Great to see you too. Thank you for the opportunity.
Yeah, let's talk about sort of the biggest changes that were announced this week. Again, leaving it up to doctors to prescribe or decide rather when they should prescribe medical marijuana, what types of conditions. How big of a difference do you think that is as opposed to having the restriction before that it had to be one of these approved conditions on that list?
Yeah, well, we're really encouraged by the recent changes by the OCM. As you know, patient access is our key and primary focus at Dent, and expanding to allow all of the medical providers to certify patients just allows for more access. Prior to this, it was indications that were neurological primarily, which now opens it up to everyone. And it actually allows to treat patients who were previously denied access to actually be able to qualify under their certain conditions that they have.
So Maria, I think this may be less of a concern since recreational marijuana use is actually legal now and soon-ish you'll be able to actually go out and buy it. But is there any concern among your doctors about overprescription out there?
No, I don't think that there's a concern for that. When the adult recreational program does go live, we do foresee that we may lose a small amount of patients for the medical marijuana population, but I think that 80% of the patients that are treated, especially for chronic pain, as with any other drug, I just think that it just opens it up to more patients, and we don't see a problem with that.
Let me ask you about something that one of our viewers reached out to us to ask about this week. They said basically they had gone to a dispensary and the worker there told them that New York State isn't able to fill out any medical marijuana prescriptions until further notice. Have you been hearing about this? Was this an isolated incident, or is there something going on in the medical marijuana world right now that we should be aware of?
No, I think this is definitely an isolated incident. We work very closely with all the major dispensaries in the area, Verilife, MedMen, Botanist. We haven't had this experience whatsoever with our patients and have had no difficulty obtaining product. So I do think that it was an isolated incident.
And finally, Maria, for patients, just being certified for this program, what should they know about upfront costs to be certified, what gets covered with insurance, and I know a lot of that is kind of still waiting on the federal government to maybe make a move in terms of insurance coverage, but what would be your quick response to people about what they should know?
Well, I think that that's an excellent question, and although I did see with the OCM guideline that they've just waived the $50 certification fee, which is great for patients because that is an out-of-pocket expense, we do have to remember that medical marijuana is still federally illegal, although it's state legal. So this is still an out-of-pocket expense. So whereas you have a physician who may prescribe medical marijuana versus an opioid, you're going to pay probably for the opioid a copay, whereas you're going to pay upwards to maybe $250 out of pocket for medical marijuana. So we need to get the payers involved, and we need to get everyone on board and on the same page.
Yeah, definitely been a lot of discussion on that. We'll see if it leads to any movement. We've been joined by Maria Caserta with Dent Neurologic Institute. Maria, thanks so much for your time.
Thank you very much.